Good morning, everyone, and thank you for tuning in today for our mental health resource webinar with a special announcement from the University of California Riverside's psychiatry residency program and all the mental health partners. This is a very exciting day, very exciting announcement that they're going to make. I'm Dr. and Congressman Ruiz, and I represent California's 36th Congressional District. As we begin, I'd especially like to thank those who are participating in today's webinar. Dr. Gerald Maguire, Professor and Chair of Psychiatry and Neuroscience at UCR School of Medicine. Doctor, do you want to wave?
All right, thank you.
Great.
Thank you.
And I also want to welcome individuals from the Desert AIDS Project in Palm Springs, Carol Wood, Director of Clinical Operations, Dr. Jill Gover, Behavioral Health Manager. Good to see you both. I'd also like to extend a very special welcome to Joseph Skrajewski, Executive Director of Medical and Professional Education, Hazelden Betty Ford Foundation. We're so very fortunate to have the foundation here in the Coachella Valley. Also, a very special welcome to Saad Niazi, CEO, Pacific Grove Hospital and Indio Behavioral Health, and Dr. Eduardo Javier. Hold on, there seems to be some, what are you doing? You're good? Okay. Dr. Technical issues. Dr. Eduardo Javier, Program Director, Addiction Medicine Fellowship, UCR, Hazelden, Betty Ford, and Eisenhower. Beverly Greer, CEO, Neuro Vitality Center. Dr. Sanjay Vaswani, Medical Director for Behavioral Health at Clínicas de Salud del Pueblo. Dr. Afshan Beg, Chief Medical Officer at Clínicas, as well as Alberto Quijas, Telehealth Manager at Clínicas. Clínicas is Alberto. Okay, so I want to thank everybody for being here today and to share your expertise and provide critical information for the Coachella Valley residents. And thank you for all the work that you do every day for our community, especially as we endure this unprecedented crisis together. May is Mental Health Awareness Month. During May, we are reminded to fight stigma, provide support, educate the public, and advocate for policies that support people with mental illness and their families. And it has never been more important than it is today. There's a lot of anxiety, stress, and changes in our lives right now. The environmental conditions caused by the coronavirus pandemic can create behavioral changes and exacerbate mental health illnesses for many in our community. Loneliness, depression, stress, and anxiety are on the rise. And it's important that you are equipped with the knowledge and resources you need to help get you through this time. Whether you're fighting depression, battling a substance abuse disorder, or having suicidal thoughts, we are here today to remind you that you are not alone and people want to help you. The coronavirus has changed daily lives and caused disruptions and hardships for people throughout the country. Families, workers, children, our friends, family, and neighbors are struggling to find routines, to stay engaged, and just get by. It is so important that you have accurate information and equipped with proper tools to manage your life, stay healthy, and get the help that you need. That's why recently I held a virtual town hall with Dr. Michelle Borba, best-selling author and educational psychologist, to talk about parenting and family well-being during difficult stay-at-home moments. So I encourage you, especially the parents out there, to go back on my Facebook page, Congressman Ruiz, MD, and watch the virtual town hall on my Facebook page. That's also why I've been fighting for years for legislation to address mental health challenges and expand resources for the community. Barriers in access to mental health services existed before the pandemic, and they are pronounced now during the pandemic. The need for more mental health services existed prior to the pandemic, and the pandemic is making the need more pronounced. That's why I've introduced legislation, and several of them have been signed by a president into law. For example, H.R. 1839, the Medicaid Services Investment and Accountability Act, was signed into law in 2019, which extended the Community Mental Health Services Demonstration Program. H.R. 5605, Advancing High Quality Treatment for Opioid Use Disorders in Medicare, was signed into law in 2018 as part of H.R. 6, the Supports Act. That's why I introduced an amendment to H.R. 1158. It was a minibus funding budget bill that was signed into law, and it increased mental health services for police officers, given that they have triple the amount of suicide than others in our community. Furthermore, I've introduced H.R. 2519, the Improving Mental Health Access from the Emergency Department Act, which would create grant programs to fund emergency departments to help get patients with acute mental health episodes to transition to the follow-up care that they need. And 5, and even as important and even more important, I have constantly fought against cuts to Medicaid program, which the vast majority of substance abuse patients use to get their care, which many of our substance abuse mental health patients utilize to get the services that they need. And I have voted against cutting or repealing the Affordable Care Act, because within that provision, mental health was made an essential health benefit that insurances will have to cover. So that's very important, because the Trump administration continues to push forward the lawsuit to completely repeal the ACA. And I've also advocated for telemedicine during the COVID care aid packages, as well as hundreds of billions of dollars to healthcare providers, institutions, to cover the loss during the pandemic so they can keep their bottom line and keep their programs and departments open. So this is why it's so important to continue to be vigilant for more pieces of legislation to increase research into suicide prevention, expand access to trauma-informed care, provide substance use disorder services, and expand access to mental health providers. It's also why for many years, and Dr. Maguire can attest to this, that I have been working with UCR School of Medicine, Eisenhower Health, Clínicas de Salud del Pueblo, and many of the folks who join us here today to ensure that District 36 and Coachella Valley residents have access to quality care, including mental health care. So in closing, I will continue working on behalf of every single one of you in my district to support our hospitals and healthcare providers as they administer first-class mental health care, and help all of us get the information and resources we need to weather this storm. So today, we are joined by experts who specialize in addiction treatment, behavioral health, neuroscience, and mental wellness. They're here to give updates, answer questions, and provide resources that help you and your families through these difficult times. So after a special announcement from UCR School of Medicine about their expanded psychiatry and addiction care resources, we will have a conversation where we'll cover unique mental health challenges the Coachella Valley is facing, resources available for residents in our community, rising rates of alcoholism and drug abuse during the coronavirus pandemic, and much, much more. So information is power, knowledge is power, because it empowers people to make the right decisions, either behaviorally or when to seek care, which can save their lives and can affect their families and their community. Especially in this moment, we need to feel empowered. and a sense of control, not only for our own personal lives, but for our families, the people we love, the people we care, our neighbors, and the community. We're in this together, and it's okay to seek help. If you have any questions throughout the program, please log on to the my Facebook page, ask the questions below, ask in the comment section in this program, and we will try to get them answered during this webinar. So thank you. And right now, I'd like to turn it over to Dr. Maguire, professor and chair of the Psychiatry and Neuroscience UCR School of Medicine. Dr. Maguire and I have worked on this project together for several years now, focusing on veterans within the VA and expanding that care as the anchor to the rest of the community. And I'm thrilled that it is finally becoming a reality. Dr. Maguire, the floor is yours.
Thank you. So thank you very, very much, Congressman. I want to thank you for your support. When I came here as a founding chair of psychiatry 6 years ago, and you're a founding faculty member of our School of Medicine, we met and you said we really need mental health resources in the Coachella Valley. And I'm happy to announce that we have a foothold, a beachhead there, working as the university to support the Coachella Valley. We've worked with our clinical partners in the area, and they're represented on the call today. And we're happy to say that not only do we have approval and we'll be starting training just in a month of an addiction medicine fellowship. So this is a partnership that we have with Eisenhower Health and with Hazelton Betty Ford. We'll have UCR fellows starting there in July, providing addiction care to the Coachella Valley residents. At the same time, as you know, we have a good pipeline of students from the Coachella Valley who get into our medical school. And as you know, what predicts where doctors practice is one, where they're from, and two, where they train. So thanks to your assistance and everyone on this call, we are realizing that now. Our first graduates from the medical school class from 2017 will graduate their 4-year residency with us in psychiatry next year. And we already have a fully operational psychiatric residency based in the western part of the county with 8 residents a year. We've grown from just 4. So that means we are producing 8 psychiatrists every year, and we've expanded with specialties in now addiction medicine based in the Coachella Valley and another shortage area of child and adolescent psychiatry. We have fellowships there. And thanks to your support too, our residents are learning how to care for veterans and their special needs. Currently, our residents are working with the Loma Linda VA, as well as now the Long Beach VA. And they're taking that expertise of our faculty to expand to the Coachella Valley as well, to care for our veterans in the future. In the meantime, too, UCR is expanding our own clinical services to the Coachella Valley this next year. And we're working with our partners all on this call to not only assist them in their care by providing our faculty to assist in the services that our great partners provide, but in placing residents, and they will partner with us on resident and fellow training such that these graduates then, who are from the inland regions of Southern California, will train in the inland Southern California and stay and practice. And thanks to other government support that we have, we will also provide loan repayment to these graduates such that finances are not a barrier for those students who are our best and brightest to not seek a medical career due to finances. So we have that going on. And so I'm pleased to announce that we have that fellowship up and running in July. And through our consortium of everyone else on this call, with our great colleagues at Clínicas de Salud del Pueblo, we're providing telepsychiatry care, and we've already done that to the outreaches of the Eastern Coachella Valley. as well. We are placing faculty at the Desert AIDS Project, and our fellows will rotate there, and soon to be our residents. We have plans as well with the Neuro Vitality Center in Greer to provide specialty care for our geriatric population as well too. And then we're very excited for Saad to be on the call because our partner Acadia Healthcare is building a new psychiatric hospital in the Coachella Valley. At this point, for those who needed urgent psychiatric care, they either had to leave Riverside County or go to the western part of the county. And we're glad to see that and this is really the foundation for us to begin that training for the 4 years for our residents to be based there. And then, of course, working with our great partners at Eisenhower Health and Dr. Eduardo Javier, who's on our faculty and leading the addiction medicine program and the teaching, and our great partnership with Hazelton Betty Ford as well too, which places us not just training that we do, but world-class training. That we'll have world-class training with the University of California behind it, with all of our partners on this call, spanning a variety of care settings, and the socioeconomic class will not be a barrier to access to care as well. So with that, I thank you for your support over these years and that we're able to make this announcement today, and our future is very, very bright as a team.
That's wonderful. I think it's also very important to realize that if you bring one fellow, then you can bring residents to train under that fellow and the attending. So it's not just one fellow, it's the medical students and the residents that come. And when you have a residency program, that opens the door to research. And research opens the door to funding.
Yes.
Which then opens the door to community outreach and community public health, mental health programs that the residents and the fellows can do. So it not only increases the quality of care, it increases the type of physicians that we keep in the desert, but it expands in the hundreds the amount of people that the fellow, the resident, the attendings can serve. And with the funding, it helps us understand our community's specific issues with mental health so we can address them in a quality manner. So I congratulate all of you. I think at this point, what I'm going to do is ask a representative from every institution to give a 2-minute words about your participation in this collaboration, this partnership, and about your institution. So I want to start with Desert AIDS Project, Dr. Gover or Carol Wood, whoever would like to say a few words.
Thank you so much, Congressman Ruiz. This is such an exciting time for us, and we are so thrilled to have this collaboration with Dr. Maguire and UCR as we are looking forward to bringing on a psychiatrist in partnership that hopefully will introduce the possibility of more training, and DAP can then be one of the many sites for training. And as we have discussed many, many times over the years, it's so important, and it's been said many times already this morning, we need to grow our own. And this is true for psychiatry as well as for psychology. And we're hoping to do a similar clinical internship training program for clinical psychologists in the near future as well. So this is a very exciting moment for us, and it allows us to provide the services that we know are so important to this community. DAP has been here for a very, very long time, and we provide many, many different services for the entire community. We have a primary care clinic, a healthcare clinic. We are a federally qualified community health center. So we provide primary care as well as a behavioral health clinic, dentistry, we have social services and case management, we have sexual health education, we have wellness programs. We offer so much to the community, and I want to emphasize that it's for the entire community. Our title may be Desert AIDS Project, and certainly we will always be a special home for the LGBT community and for those living with HIV. But we serve everyone, the entire community, and we want to make sure that the residents here in Coachella Valley know that our services are open to them and that we have a variety of different services. And I'll speak more about behavioral health.
And you're doing coronavirus testing as well.
Yes, and we have the COVID triage clinic. Yes, we are offering testing, both rapid antibody and the COVID test swab.
Excellent. Now, Joseph Skwarczewski from Hazelden Betty Ford Foundation. Would you like to say a few words?
Absolutely. Thank you, Dr. and Congressman Ruiz. And it's a pleasure to be here today. You've been out to the Betty Ford Center many times over the years, and I've seen you in Washington, D.C. a number of times. And you've always been so supportive when it came to substance use disorder services, mental health services, and really rallying behind the Coachella Valley. So it's an honor to be a part of this morning. Dr. Maguire and I had a dream 10 years ago. We started working towards this a long time ago. What would it look like to have a fully ACGME accredited addiction medicine fellowship right here in our valley? And so much work between Eisenhower Health, University of California, Riverside. So many people on this call this morning went into making this a reality. So my heart is full at singing this morning, and I'm proud to be here representing Hazelden Betty Ford. For 12 years, I've served the honor of being the Executive Director of Medical and Professional Education. I live 2 miles from our Rancho Mirage campus right here in the Coachella Valley. And Hazelden Betty Ford is a force of healing and hope for individuals, families, and communities affected by addiction to alcohol and other drugs. We are the nation's largest nonprofit provider of comprehensive inpatient and outpatient treatment for adults and youth, with 17 facilities in 9 states throughout the United States. We have an expansive network of healthcare providers and a legacy that began in 1949, including the 1982 founding of the Betty Ford Center right here in the Coachella Valley. Today, our foundation encompasses a graduate school of addiction studies, a publishing division, an addiction research center, a recovery advocacy area, professional and medical education programs, school-based prevention resources, and a specialized program for children who grew up in families with addiction. As all of us know, we're confronting 2 public health crises right now, COVID-19 and addiction, and our services are needed now more than ever. So by continuing to provide care, we've taken pressure off hospital systems that otherwise would be seeing more patients in their ERs with addiction and mental health issues. Throughout this pandemic, we've been able to admit new patients every single day in a number of different settings and levels of care. Patients continually come to us, and they're so grateful that care is available during such a challenging time. They're remarkably resilient, and there's nothing more inspiring than seeing people initiate major change in their life, especially at a time like this. As we know, this will pass, and in time, we'll never forget what's really important in life. We'll never forget how important empathic connection is. And many times in our history, this country has emerged from huge challenges, hurt, but stronger than ever. Perhaps once we're beyond the worst of this pandemic, the world will understand recovery and empathy in a way it never has before. And so to close, there's always hope. These times will pass. Recovery is possible, and help's available even at a time like now. Thank you so much.
Thank you for those words. Saad Niazi, CEO, Pacific Grove Hospital and Indio Behavioral Health. Would you like to say a few words?
Yeah, good morning. Thank you, Congressman Ruiz. Thank you, Dr. Maguire, and everybody on the call. I work for Acadia Healthcare. We are building a new state-of-the-art facility in the Coachella Valley, right in the heart of India. Like inpatient treatment of geriatric, adolescent, and adults, and also serve a chemical dependency population as well as a full outpatient range of services. Currently, my hospital, our current hospital, is down downtown Riverside, and 40% of our patients come from the Coachella Valley. What we've seen as a struggle is adding services to that area and the continuum of care that is needed and the preventative care that is needed. We have preventative care for quote unquote medical issues, CHF, diabetes, but not for mental health in the Coachella Valley. And that's what's been a big struggle. With this new hospital, we'll also be a training hospital, partnering with UCR to train residents, have medical students, nurses, social workers, nurse practitioners, PAs, so that we can build a workforce in the Coachella Valley to serve the Coachella Valley. That is our biggest goal. We hope to continue to expand those services. Acadia Healthcare operates over 600 facilities worldwide, all behavioral health and addiction medicine. We currently run clinics in the Palm Springs, Coachella Valley area, treating those with addiction issues. And our partners in the community, we're very, very excited. We're hoping we will start construction next month on the hospital. It'll take about 14 months to build and hopefully be ready to serve the community by mid next year. So thank you to everybody who made that possible. And we look forward to continue to provide care to the Coachella Valley residents.
That's wonderful. That's wonderful. I can't wait till that building goes up and we start seeing patients fill the hospitals. That's amazing. Thank you. Eduardo Javier, Dr. Javier, you have a very special role in this. You're going to be the program director of the Addiction Medicine Fellowship with UCR, Hazelden, Betty Ford, Eisenhower, collaborative with all your partners. How are you feeling? What's your thoughts? You got to unmute yourself. Yeah, there you go.
Sorry.
You got it. I can hear you.
All right. So, yeah, thank you so much, Dr. Ruiz, for this great opportunity to be here today. I'm so glad to meet all of you, by the way. I'm very happy to be a part of this program. So I've been doing addiction medicine for about 8 years, and I see the frustration of having patients in the emergency room admitted here at Eisenhower Health, and they don't have nowhere to go, and I don't know where to refer them to. So where this fellowship is going to provide an outpatient clinic so that patient can go and have expert advice regarding their problems. So our goal is to link all this care that we have right now with Arcadia Health, with Desert AIDS Project, with the Methadone Clinic, and bringing the expertise of Hazelden Betty Ford Center Foundation for regarding treatment of addiction. So the goal is to link all this care, and we're very happy to train new physicians that hopefully will stay in the valley to answer the shortage of care for addiction medicine. So thank you for your support. I thank you for your support personally. So yeah, excited that we're starting in July. July 1st would be a big day for us, and I thank you from the bottom of my heart for all your support. I will be talking to all of you in the next few weeks. So thank you again.
That's wonderful. And please keep in mind, whenever you have fellow rounds or grand rounds, now that we're doing a lot of video conferencing, I would love to sit in and rekindle and re-exercise the doctor brain and training that I have, and really get caught up with some of that medicine. I think it'll help fill in some CME credits that I need to keep up with. And so you all are smiling now because you know that's
Yes.
That's
and if you can pencil in every first and third Wednesday at noon.
Great.
For your grand rounds and journal club, Congressman.
I would love that. That would definitely fit my CME credit requirements.
That's perfect. Yeah.
Which I'm still doing. So thank you for that offer. I self-invited myself, so thank you, thank you for allowing me to do that. Next, I want to introduce Beverly Greer, CEO of Neuro Vitality Center. You got to unmute yourself, Beverly. There.
So you're on mute still.
Okay, that should work. All right, we're good to go. Dr. Maguire, it's great to see you again, and thank you for inviting me to join this illustrious group. It's great to be part of the consortium to really bring more mental health to our area. It's such an important issue that we've all seen. We here at the Neuro Vitality Center have been around for a long time. We've been around for 42 years handling people with neurological disorders, and have in the last couple of years expanded our services to handle all forms of adult daycare, which includes, of course, behavioral health along with medical health and also socialization and all of the issues that Dr. Ruiz, you brought up, the isolation, problems that are depression, and of course, anger management, and all of those things that happen when you are chronically ill is such an important component. And working with Dr. Maguire, which we have for years now, we're finally getting to the point where we are going to be able to offer more expanded services here working with UCR. So that's very exciting to us. Unfortunately, right at the moment, our program is in vast danger. The new budget cuts in California budget are discussing eliminating the CVAS program, which will eliminate care for those Medi-Cal patients who are nursing home eligible but able to stay at home because of our program. It's very unfortunate, and we're hoping that not only the Assembly and the Senate will understand that not only is it immoral, particularly in light of what we're doing right now with the very high-risk people that we have, but that it's also fiscally not a very good idea, because those people then wind up in institutions, in nursing homes, in very high danger now of infection, and also in ERs rather than our being able to care for them. We have converted all of our services, not being able to congregate, of course, with this very high-risk group. We have converted all of our services to virtual. The vision I'm looking at right now is also going on just down the hall from my office, and with a whole group of patients that are all enjoying. I think they're doing morning stretch right now. I think they're exercising, and they're also engaging with one another and trying to keep that kind of engagement going, so they're not suffering from the loneliness and the depression and the additional problems that are converted when you have a chronic illness. So I'm glad to be here, and we're looking forward to moving forward with UCR.
That's wonderful, Beverly. Thank you so much. And now from Clínicas de Salud del Pueblo, Dr. Afshan Beg, would you like to say a few words?
Sure. Thank you for this opportunity, and Dr. Ruiz, Congressman Ruiz, as you remember, thank you for that. We have met, a long time ago, but have been associated with the work that you're doing and following it, and being proud of you, because you are from the Coachella Valley, and your commitment to the area has really been an inspiration that I myself find repeating myself many times. So thank you for that. Clínicas de Salud is a federally qualified health center established in 1970. So this is year number 50 for us. Our model is of integrated behavioral health. And basically what we've been working on for the past few years is integrating the behavioral health aspect of patient care to the physical health, recognizing that it is very important that both those challenges to a person's health are recognized concurrently and addressed in a appropriate manner. So if you're going to affect the diabetes or the hypertension, we better recognize that there's another aspect of depression, anxiety, or any other issue that might be impacting the outcome. So that is what we've been developing for the past few years. With UCR's help, we have been able to address the shortage in our area using telehealth. So I really appreciate the willingness and the flexibility that Dr. Maguire and his team have allowed us to avail of. And it's a work in progress still, because clinicians as well as patients have to learn how to utilize this resource doing behavioral health using the telehealth technology. So we are really, really appreciative of that. We have got licensed clinical social workers on staff. We've got psychiatrists on staff. Dr. Vaswani is the medical director for behavioral health, and he has really, he is originally from the LA area, but has committed himself to Imperial and Riverside counties, and we really, really appreciate his commitment to our model of patient care. And again, very, very excited to be actually seeing some of you for the first time, and looking forward to continuing our work together and going forward. Thank you.
That's wonderful. I mean, you all are an all-star team. If one was to devise the perfect psychiatry neuroscience fellowship in the Coachella Valley with the focus on addiction, you all are the right partners to have in place. That's not to say there are other amazing programs out there and institutions. Your collaboration has really gone into where the needs are greatest as well. And you have 2 FQHCs as part of your residencies, and you know that my hearts are with community health centers because they're oftentimes the ones that serve the poor and those that lack access to care. So why don't we go ahead and get started with some of the questions. And I want to first ask Dr. Maguire from the UCR School of Medicine. One is, what have been some of the most common psychiatric symptoms or disorders that have manifested themselves in during this pandemic? And then in addition to that, how will this fellowship address health disparities or the inequities that you see some communities who face the greatest barrier to care?
Great questions. You know, on the front lines, I will tell you, as a psychiatrist who treats patients in Riverside and in the Coachella Valley as well too, many of our patients are struggling with the burdens of isolation, where disorders like depression can be worse. They have, where family discord can occur. It's also been especially, I think, been difficult for those families who have fewer means, where now their work-life balance is, if they still have work, has been disrupted because they may have to take care of children at the home and work at the same time. So that has put undue stress on many of our clients as well too. And I must say, unfortunately, that unemployment has put a greater stress. Now for, unfortunately, many of our patients, the financial stress is there as well too. But fortunately, you know, there is help, there is assistance through all our teams that we have here, and we're able to reach out. I will also say that a barrier that I have seen that we still have to overcome is the telemedicine, even though we reach out, and that, you know, I'm still open. My patients can come in, but for many of them with the stay-at-home order, we're doing telehealth. But still, many of my patients may not have a device with a webcam. They may not be able to afford that, or they don't afford Wi-Fi. We might take that for granted that every home has broadband, but for many of our residents, that is not a reality still, or they can't afford a data plan on their cell phone. So we still have, unfortunately, Congressman, an inequity there. And what we are doing at UC Riverside is partnering, as you said, with our FQHC partners, as you have, which allows that access to care for those folks who may not have the means of a commercial insurance plan. The next that we are doing as well is training and recruiting culturally competent physicians. As Dr. Baig is aware and Dr. Vaswani is aware, the lead clinician that I have providing care to the Clinicas population is Dr. Roberto Castaños, who was my own medical student and resident. and is faculty with me now. Spanish speaking provides that care. I look at hiring another Latinx Spanish speaking psychiatrist. She's graduating from my program, and I'm hopeful she stays with me. And then we have a pipeline as well, too, of students coming up the ranks like Edgar Ortega and others who are in. I view this like building a baseball team. And I would say my AAA farm system is very strong, and that we're in the playoffs now, but we'll be a World Series champion here to address the inequities in our system by decreasing barriers to care from finances or cultural issues, and also reaching out to decrease the stigma with increasing health literacy in our vulnerable populations.
Dr. Maguire, I'm going to ask you offline.
Yes.
You can answer this if you don't know now, but if you can give me the information. So in 2009, I met with a group of 7 students from Coachella Valley High School and Desert Mirage High School.
Yes.
And they started shadowing me in the emergency department. And we expanded the program to bring in other doctors from Eisenhower. And then in a couple of years, we had 11 institutions. We had 70 doctors that volunteered their time to mentor my students. We had with initially about 60 students. Now it's over 200, and it's now the Future Physician Leaders Program, housed under the School of Medicine, with high school and college students who are in that pipeline to become doctors and serve. So my question is going to be, are those students going into mental health services?
Great. I will look at the data. I believe I'm looking that that my PGY4, soon to be PGY4 chief resident, is a graduate there. My soon to be PG3 is from there. He's a UCR student. And what's great, I will take a little bit of pride in this too, thanks to your great help, in that I believe that UCR is recruiting and retaining those medical students who are more dedicated to the underserved specialties of our field. So this graduating year, they graduate tomorrow, actually, of our class of just over 55, I believe, 16 are going into psychiatry. I believe, I'm gathering data, but I believe that may be the highest percentage of any medical school in the United States. I'm looking at that. So it shows you that we're recruiting those students who are committed to the underserved. And what's great, we are retaining them as well too. And we have to expand our residency more, because we don't want to train our students from the inland Southern California and have to export them to finish their training. We want them to stay right here, take care of our patients, and serve the community for generations to come. And thanks to your efforts back in 2009 and getting our medical school started, we are reaping the benefits now.
Well, I'll tell you one thing. These are farm worker kids, kids of construction workers, waiters and waitresses, first generation to graduate from high school, go to college like I was, that have a dream to be a doctor and to serve their community. So this, for all the parents out there who have children, or for all the youth that want to be doctors, that want to go into the medical profession, no barrier too great for you to have to overcome to accomplish your goal, your dream. I'm an example. And go to Future Physician Leaders online and put your application in so you can be part of this amazing pipeline program. I have a question from the press. Shelby Nelson, who's from KESQ, does amazing work. The question is, we don't know how long COVID-19 will last. Do you foresee a heightened need for mental health services, even if this were to wind down? And how can this program be a part of that? Go ahead, Dr. Joseph Skwarczewski.
Yes, thank you, Congressman Ruiz. The reality, as we all know, is that substance use and mental health challenges were already at crisis levels prior to the pandemic. And now with people sheltered in place, stay-at-home orders, other pre-existing health issues, they're experiencing more anxiety, more depression, usage of more alcohol and drugs, more grief, more trauma. So we've got this system right now whereby some individuals are able to seek services, whether that be in person or virtually, but many of them right now are into their addiction at a level that they've never been before. So we do expect a surge in individuals needing help both now and in forthcoming months. I do think it's important, just as we talked about, in building that pipeline in our valley here. If I could add one more thing that I just think is so important and speaks to the services that we need to provide here. We've had a children's program for 7 to 12-year-olds from addicted families right here in the Coachella Valley for many years. And those kids come in, brought in by guardians, brought in by grandparents, brought in by others, because a lot of time, mom, dad, others are still drinking and still using it and really struggling during the COVID-19 pandemic. And other times, a lot of those kids get educated on substance use disorders, find their way, find their dream, and end up in places like medical school, like law school, like nursing school. We have a program called the Summer Institute for Medical Students. And I mean, like, our dream always was to have a kid from the Valley, 7, 8, 9, 10 years old, that would come and get care here to learn about how it's not their fault that their mom or dad drinks or uses, that it's not their fault that there is trauma and anxiety and depression and death and loss and grief. And they find their way. And so many of those kids have gone on into medical school and come back literally like 15, 20 years later into our valleys, first, second, third, fourth year medical students, ushering their way into residency and fellowship, which I think is the goal for all of us. I mean, we all have our purpose, right? We all have our reasons, and we're all doing so much at all times. But in a time of crisis, in a time of need like now, I think we're constantly looking for wins like that help build that hope, and letting individuals know that, yes, we are open. Yes, we are here for you. And even though you're struggling right now, like all of us are during COVID-19, let us know whenever you're ready, because we'll be here.
I have a follow-up question to that, if you can answer this. Oftentimes, families are also greatly affected by a person's mental illness. It could either be through their addictive personality, addictive behaviors. It could affect them emotionally, financially, but also individuals that don't have addictions. For example, people with bipolar mania, people with clinical depression. It really does affect the entire family. And family members don't know how to cope. They don't know how to help. And oftentimes the individual doesn't want that help. And they don't know how to get that help. And the family member, they don't know if they can get services to help them cope with a relative who's not getting services. So, I'll ask you, Joseph, what do you offer for those family members who need help themselves and who need help convincing their relative, their loved one, to go get help? And then I'm going to ask Jill the same question. Joseph?
Yes, thank you, Dr. and Congressman Ruiz. It was so interesting. In 1982, Mrs. Betty Ford had this foresight. She wanted to open a treatment facility, but she also wanted to make sure families were taken care of. And she was criticized at that time. People were saying, get your treatment right first. And she said, no, this is a family disease, and we need to make sure we're treating the families. So literally from the day we opened our doors here in the Valley 38 years ago, we've provided a family program every single week. And you're right, people come into our offices, they go to see their primary care provider, and they don't typically walk in and say, I have a substance use disorder, I'm ready for help, right? They walk in with things like anxiety, like depression, like bipolar disorder, other sort of conditions, many of which are brought on by the other person in their life that is drinking and is using right now. So to provide a venue, provide an opportunity for them to learn about addiction in a family environment setting, realize that they're not alone, that there are other families like them that are going through that similar experience. Let them know that there are resources, places like Al-Anon, places like community providers, different types of clinicians that are out there looking to provide services to them. I mean, during COVID-19, we had an on-site family program at a lot of our facilities. Well, the reality is that most people aren't getting on airplanes to come to facilities right now, or many of them are staying at home. So what we immediately did was pivot to providing a virtual family program, which was one of the first things we did, I mean, months ago now, to provide that multiple times weekly so that people all over the world, regardless of time zone or wherever they're trying to get services or resources regarding what the family is going through, would be able to access that type of service.
That's wonderful. Jill, do you have something to add to that?
Well, I feel I'm just echoing what's just been said so eloquently, but we're doing exactly the same thing at Desert AIDS Project. Months ago, we pivoted very, very quickly to providing different options for patients so that they can still choose to come in for face-to-face therapy sessions if that's their preference, but also realizing that majority of people currently are wanting to shelter in place, and being able to offer MyChart virtual visits, so video conferencing therapy sessions, as well as phone telemedicine, and thankfully with all of the loosening of restrictions regarding the telehealth, we've been able to do a very quick shift to telehealth, both in our medical clinic and in our behavioral health clinic. And I just want to emphasize again that it is so important that people know we are here to help them deal with what could be a loved one's mental illness, which can create a great deal of stress and anxiety, help them deal with what's coming up for them around COVID, all of the isolation. There's so much grief, because we need to recognize that all of us are grieving the loss of life as we once known it to be. Everything has changed so dramatically for us in such a short amount of time. And all of us can benefit from therapy. And I think that that's a very important message to get out there, that therapy can be a gift that we give ourselves in the name of self-care. And we need to take advantage of the services that are available. And certainly DAP is welcoming in that way.
Jill, many people think that you have to have an illness to practice mental health. In fact, it is very equivalent to nutrition as part of a healthy life. It is equivalent to physical exercise.
Right.
To illness and to maintain a sense of well-being, you need to daily practice good behavior, good exercise. And so daily you have to practice good behaviors, either mindfulness, prayers, there's meditation, there's the happy center in a brain that can be developed to make a person more positive, joyful, and that can help maintain a level of good mental health. I read, right now I'm reading the Psalms, and I do my prayers in the morning, and that's a very daily activity that keeps me focused on hope, on positivity, where I draw my strength. And and with my girls, pause and practice mindfulness. I shut everything down. I look at them and how much joy and happiness they give to me. And I pause for that moment, and I give them love, and I receive their love. And that gives me that happiness in my life. A question for Beverly. What services do you provide, and to who? And what are some challenges that you're facing right now to provide those services? You're going to have to unmute yourself. Again.
Basically, what we heard. Period?
Yeah, good.
Yeah, good. Okay. We of course, and where you started with the family is a very important factor with everything that we do. Our population is basically the those people that have suffered chronic illnesses, had strokes, that have had different types of issues, including mental health issues as well as physical health issues. And our basic premise has always been to deal with the person as a whole. I echo what you say so much about mental health. It's such an important factor, along with the physical health that we look at, and exercises. We exercise the mind and the spirituality as well. It's very important. And then, of course, with the other element that we bring in is the socialization to eliminate that depression and loneliness and isolation that people are feeling. And particularly, one of the things that we find to be most effective, and I'm sure that that Jill and Jill find this as well, is the ability to bring, say, family members together who are additionally confronting the same types of issues, and be able to share experiences and be able to really work together to try to find solutions and realize that they're not alone in all of these problems. People that are very severely disabled respond so well in groups with other people. People that are suffering from various forms of mental illness problems really respond well in groups, and that's really what this environment has brought the greatest challenge, I think, to all of us, is how then do we get those advantages of bringing people together and of having them help each other in this type of environment. Fortunately, the technology has improved dramatically from over the past few years, and we're able to use this type of situation. We have almost everybody in this valley at least has access to a cell phone. If they're not able to have Wi-Fi or whatever, we are providing them with tablets that will hook into telephones. And although it is an additional cost, it's something that we feel we just have to be able to do to be able to help these people so they're not stuck out there alone. And no matter what happens with going forward with the state and the budget, we've been around for 42 years, and we're going to find a way to continue to help these people, because we can't, in all conscience, leave these people alone and by themselves with no hope. That's not something that is part of our DNA, and we're going to continue to find ways to help them. And the challenges of the technology, I think, are amazing to see, because all you need to do is bring a group of your people together and watch them all respond to each other, the faces that they see on the screen, just to be together and to be happy to be there. It's a feeling that you can't even describe. It's a wonderful thing, and that's what mental health is all about.
Thank you. My next question is to Dr. Javier, and I think this is going to be one of the most important questions of the evening, because for a lot of people, they don't understand when they need to go get help. It is natural to feel a level of anxiety, a level of concern, of loneliness when you're asked to stay home, you're not connected, you don't have your routines, you're not seeing the people that you have. That's a natural feeling that people can have, and based on their coping mechanisms, based on how they their normal outlook in life.
Fuzzy. I don't know.
Question.
I think I'm gonna go there when she's done talking.
Guys, you guys are not on mute.
I don't know, but
Alex, you're not on mute. Thank you. So the question is, at what point is it required to seek professional help or to seek assistance in coping with these symptoms? So first, what are those symptoms, and how do people recognize that within themselves?
Yeah. Got it. Thank you, Congressman. So first and foremost, to answer your question, we would advise everyone to not delay seeking help with substance use problems and issues. So we've seen a lot of cases because of the sheltering in place and isolation, people try to withdraw and not seek help. So we would advise anyone to reach out to their primary care providers, to their community advisors, to their self-help groups, communities, to voice out and to seek help. So the symptoms, to answer your question regarding if there's worsening of symptoms of addiction. So we go by, addiction is defined as a chronic relapsing disease. We go by the 4 C's of addiction. So what are these 4 C's? These 4 C's are, if they lost control with their addiction, they lost control with using their substance, they continue to use despite consequences of their use, such as, not fulfilling their responsibilities as a with their jobs and as a family member, increasing their use, increasing their consumption, and 4 C's are very essential for recognition and recognizing the escalator of substance use. So once they've recognized this, do not delay in seeking help because of this being isolated and not being available to them. They can seek help through the SAMHSA. There's a 1-800 number that they can call for the nearest providers that they can in their community. There's a 1-800 number. ASAM, which is Association of Addiction Medicine Society, has a call number as well for
So I think the 4 C's can be also applied to other mental health illnesses as a way to determine when it's beyond what would be considered normal stressors and when somebody needs to seek professional help. The key element that you mentioned in one of those 4 C's is when the symptoms prohibit somebody from functioning and performing their daily life duties, right? So they can't function as a parent. They can't function in the sense of making food in their daily lives. They can't function. The overwhelming stress prohibits them from maintaining their personal hygiene for some reason. They can't shower, they can't bathe, and so they don't eat because, or they've lost an enormous amount of weight, or they've gained weight, or they can't sleep to a point where they're having symptoms of insomnia and others, and that affects their ability to function. And so that's a level of stressor or anxiety where one should say, okay, I should start calling to get professional help. So that there are techniques, there are ways to refocus, to reset, to cope, and to get back to a state of normal life. And there are some techniques that can be used today with the stressors that people have. We're going to have a few more questions, and then I'm going to ask Dr. Maguire to close, and then we'll close this session. But Dr. Baig, what are some of the illnesses or the stressors that clínicas are experiencing, or the patients are experiencing that visit clínicas in the East Valley or throughout the poor communities that you serve?
So basically, as I shared earlier, our model is of integrated behavioral health. So as it is, we have lots of patients with diabetes and hypertension and other chronic conditions, which then the behavioral health component exacerbates. So they are both linked together. What we are focusing on is early identification and then intervention. And I really appreciate the full gamut of the participants, the panelists that are here right now. But what we try to do is keep them, identify them, help them, or find resources for them earlier on so that they do not progress and that is what we are continuing to focus on. In the early stages of the pandemic, there didn't seem to be anything visible to us other than COVID-19. But in the last week or so, we have move the conversation again, look at the whole person. It's not only about COVID-19, but what else is going on in these for these patients to make sure that the diabetes is getting the care, the hypertensives are getting their care in a timely manner, the kids are getting vaccinated. So again, that is our focus.
Great. Carol,
to make
would you like
sure.
to add something?
I'm sorry?
Carol, would you like to add something? Carol Wood?
Am I unmuted?
Yes.
Very good. Yes, I would agree with what the doctor has shared. We have a full service operation here as well, and we're just so thrilled to be a part of this consortium. Having worked in this inland empire for the last 30 years and seeing the high demand for services and the ability for patients not to find those services locally, so critical. Our collaboration in the training and the future, being a future clinical site for the residents and the fellows is just so very exciting for our organization. And in particular, we're excited to have Dr. Jamie Woods, the psychiatrist faculty, to be joining our DAP Behavioral Health Department probably within the next month. So we're very anxious to be a part of this. We're looking forward to training the residents. I was previously involved with a residency program in the Inland Empire, and we know how important it is to train our own and to keep these physicians in our valley. So just exciting to be a part of it, and thrilled to have been invited to join.
Thank you. Thank you. Dr. Maguire, last few words.
Well, I just want to thank your leadership and vision, Congressman Ruiz, for getting the medical school started, meeting with me early on as the psychiatry program was getting going, and for all our colleagues in the Coachella Valley and building this consortium. It takes a village to train doctors. And we at UCR, we're unique among the University of California medical schools in that we don't have our own hospital, unlike UCLA or UC San Francisco. Instead, our model is community-based. We go where the patients are, and we work with the teams in the community to assist you in your care and meeting that physician workforce needs. What we will do as the academic, as Congressman Ruiz said so well, is we'll work with all of you to train the next generation of physicians, provide the faculty for your services, and grow our own, and then bring in that research component for all of you. That research, which will allow the residents of the Coachella Valley to really receive tomorrow's treatments today and not relegate or let's say limit those newer treatments to those who live in more coastal areas of our state. We're bringing that here. That's what the university is all about. And I have a simple metric. It's my 6th year here as UCR as a founding chair. I want to be looked back at the 10-year mark, not how much NIH funding I brought in or other things like that. I want a simple metric, which is the mental health care and the mental health of our community. Is it better in 10 years because UCR School of Medicine was founded? And working with all of you and with your leadership and support, Congressman Ruiz, I think we are well on our way. I thank everyone for joining this consortium. It's realized our first fellows are starting in July. Excited about that. We have a new hospital being built. And we're looking at the partners in the Coachella Valley. Thank you all very much. This is exciting for me as a chair. It's good for our community. It's good for the physicians and the allied health professionals that we will train as a team. So thank you all very much.
Thank you, Dr. Maguire, and to the viewers who have tuned in and listened in. I want you all to know that I care about you. Everybody on this screen cares about you. Your family cares about you. We want you to live healthy, happy lives. We want you to cope and weather this storm. There is hope. We will get to the other side. Our researchers are actively working on a vaccine. We have faith in the scientific process and public health. We will get to pre-COVID times when we have that vaccine available. We will get to that state where we can have a more social life again. And just know that we're here with you. We're all in the same boat, and we're going to take care of one another. So thank you very much. I want to thank KSQ and NBC Palm Springs for tuning in, and for all the others that will be covering this as well. Thank you all for being here, and have a good day.